All right, thank you for joining us, everyone. My name is Dr. Michael Fernandez. I am with Kinetic Physical Therapy. Normally joining me is Dr. Jared Bonaquisti, but he's unable to make this session, so I will be actually reviewing some things that we talked about last week. The session last week, unfortunately, had some issues with the audio, so we just wanted to make sure that everyone had the information that we had discussed. And so we will be posting this on our YouTube page, so you can always go back and review that as well. And we encourage you to share it with anybody who you know might be struggling with some sleep difficulties, particularly if they're having issues with pain. So one of the things that we talked about last week was the role that sleep has in the recovery from injury. And one of the things to consider is this: during the daytime when we're living our lives, a lot of our energy is used to supply energy to our brain. What happens when we sleep is, as we go into different levels of sleep, our brain gets the opportunity to rest. And then this energy then gets diverted into things where we start to see regeneration of cells and healing nutrients and hormones are released for the body. So as we go into these deeper states of sleep, it allows our body to divert that energy from the brain function to healing the body. So if you or someone you know is recovering from an injury or having pain, it's important to understand that getting a good night's sleep can be a crucial part or an element of your recovery process. And the other thing to consider is this: if you're an athlete, how does sleep affect sports and performance? There are studies that show that there is an increased risk of injury after one night of poor sleep. When we have poor sleep, our attention, our focus, our mental acuity might be impacted by that. And as we're on the sports field or competing, now, because we're not as sharp as we normally would, it shows that there's potentially up to a 50 or 60% increase in your likelihood of suffering an injury. So again, kind of goes back to the importance of getting good quality sleep. And if you or somebody who maybe struggles with this, or you have a child who is competing in sports, it's important to understand this in order to kind of work through some strategies and how you can improve your sleep so that you can stay on the field and stay healthy. One of the other discussion topics that Jared and I had spoken about was the connection between chronic pain and sleep. And are people more prone to chronic pain than others if they don't sleep well? And there's abundance of research that shows that people who are experiencing chronic pain tend to be poor sleepers as well. A lot of the research tends to look at it from the perspective of there's a correlation, but usually we suspect that the cause is the pain that affects the sleep, which is now the effect. There's not a ton of studies that specifically look at, does sleep cause an increase in the chronic pain? And there was a recent study that we had discussed again last week where UC Berkeley, that was done at UC Berkeley, and this is a small study, so there's certainly a need for larger sample sizes and maybe some more exploration in this. But we already know there's a correlation between poor sleep and chronic pain. And what this study that UC Berkeley looked at suggests is that after even one night of poor sleep, what they found was that centers in the brain that are good at detecting pain are upregulated or become more active after one poor night of sleep. So after that poor night of sleep, we are more likely to detect pain the following day. The other thing that it showed was there was actually a downregulation or reduction in activity in the area of the brain that releases the hormone dopamine, which is often released in response to pain and has an analgesic effect or a numbing or dulling effect to that pain. So what this study indicates is that when it comes to treating pain, and particularly chronic pain, sleep may be a very important role in treating, in the overall plan of treating someone with chronic pain. We will actually do a session or a webinar in the next several weeks on chronic pain specifically To touch on it briefly, chronic pain is pain that typically has lasted for a prolonged period of time. We're usually looking in the area of months or years. Chronic pain can come in the form of low back pain. That's the one that people are most familiar with. But people can have chronic pain in the arms, their legs, their necks, their shoulders, anywhere in the body. And what chronic pain typically is a hypersensitivity or oversensitive nervous system. It doesn't necessarily mean that there's a structural or anatomical issue or an anatomical impairment. What it means is that the body has become so good at detecting pain that now stimuli, which are normally painless, are now perceived as painful. And so how this study could possibly connect to that is showing that we can, by improving sleep, perhaps affect the body's ability to sense that pain as well as respond to and dull that pain. We also know that just movement and exercise is crucial for treating chronic pain, And again, we'll be talking about that in a few weeks, so please look out on our Facebook page for that listing. The other thing that Jared and I had talked about last week are some just basic tips that you can use and implement right away in order to try and improve your sleep at home. So one of the most crucial things that at least helped me with my personal sleep issues is the waking at the same time every day. Whether it's the weekend, whether you work a morning shift and then an evening shift, if you can set the same wake time every day, it's going to help your body get into its natural circadian rhythm. It's going to naturally give your body the sleep pressure at night that, okay, it's time for me to go to bed because I've been awake for so many hours. So the only way, that we can really get into that is by setting that consistent wake time, even on weekends, even when we want to sleep in. The other thing is, if you're having trouble falling asleep at night, which happens to even the best of sleepers, don't lay in bed. If you're having trouble falling asleep, get up out of bed, go to another room, and find something else to do. The more you lay in bed, the more that you focus on the fact that you can't fall asleep, the more likely it is that you're now going to perceive your bed as a stressful or wakeful environment. So if you can't fall asleep in 20 to 30 minutes, it's probably a good idea to go into another room, especially if you're starting to get anxious or frustrated about the fact that you can't fall asleep. Avoid naps during the day, particularly in the afternoon. We talked a little bit about the sleep pressure that builds up. If I wake at 7 a.m. every day, by the time it gets around to later in the evening, now my body is feeling that pressure that, okay, it's been a while, it's getting close to time for me to shut down and maybe go to sleep. If we take naps, particularly later in the afternoon or in the afternoon, it actually can reset that sleep pressure a little bit. And so that can disrupt your sleep and rob you of good quality sleep that evening. So as much as I personally enjoy naps as well as the next person, it's really important to try to avoid those as much as possible when we're trying to set a quality sleep schedule. Your bed and your bedroom should generally only be used for sleep. And I think that this is probably most common with our adolescents, particularly adolescent athletes that we treat in the clinic, where you might be on your phone, might be watching TV, maybe watching Netflix on your laptop. These tend to be stimulating activities. Your body now perceives the bed as a wakeful or stimulating environment. So again, we want to set the stage that your bed is now a place of comfort, of relaxation, and of non-stimulating activities. So if you're going to use the phone, don't use it in the bed. Use it before you go to bed, and use it outside of the bedroom so that your bedroom becomes that place of rest. Exercise is also crucial and shown through an abundance of research to help improve sleep. We talked about the connection between exercise and chronic pain, and we talked about the connection of sleep and pain. So it stands to reason that exercise should be a crucial part of anyone's program if they're trying to manage chronic pain, or even if they're just trying to improve their sleep process. Now, exercise should probably be done more early in the day versus right before bed. If you do it right before bed, it tends to get your body temperature up. tends to get some of those excitatory hormones released into the body. So it may actually cause you some difficulty falling asleep. However, doing it earlier in the day can actually really help with sleep, particularly if you're doing it consistently over time. If you're somebody like me who maybe has a lot of racing thoughts in the evening time, something I learned through cognitive behavioral therapy for myself is the value of journaling. And this can be done pen and paper or on the laptop, but again, away from your bed, away from your bedroom. And so what journaling allows you to do is get some of those repetitive thoughts that are sticking into your mind an outlet. So an hour or two before bed, sit down, take 15 to 20 minutes, and just get all those thoughts out on paper. When you're done, that can help calm the mind, at least to a certain degree, so that when you lay down in bed, which is often the first time that we have a chance to sit down and actually think about things, now we start getting those thoughts going over in our brain. By doing the journaling, it can sometimes reduce the amount of that and allow you to fall asleep quicker and easier. One other thing, avoiding large meals and caffeine in the afternoons, particularly close to bed, are certainly, another basic tip that you can implement right away. Having large meals before bed, and then going and laying in bed, sometimes that can lead to heartburn and some other digestive things that can certainly disrupt your sleep as well. Certainly, we know caffeine has a stimulating effect, so avoiding caffeine in the afternoon can also be crucial, especially if you're somebody who has trouble sleeping. One of the vicious cycles that people can get into, I myself was in at one point, is having caffeine to try to get through the day, but then by having that caffeine, it now disrupts my sleep at night. I don't get a good night's sleep. Now I need more caffeine the next day, and it becomes this vicious cycle. So trying to cut that caffeine out in the afternoon can certainly give you a better long-term effect. So again, these are very basic tips. I by no means am a sleep expert. However, I do have a lot of experience from my own personal issues with sleep. And so if anyone has any issues or concerns, they can certainly reach out to me at Mike F at kineticptpa.com. But again, if you're having more serious sleep issues, obviously you want to consult with your primary care physician or maybe a sleep specialist if you have bigger issues than this. If it's just some minor difficulties like this and you make these changes, maybe you can see some success. If you're not having success, then probably you should end up seeing a specialist for that. So again, I appreciate you joining us. Please share with anybody who you think may have or may gain some benefit from this. Also, keep looking out on our Facebook page as we continue to post more topics of discussion. Our next topic will actually be this Friday at lunchtime, 12 o'clock, with Dr. Jeff Kurtz, where he talks about warm-ups for golf. This is a follow-up to a previous webinar that he had done on the mechanics of golf and how to improve your golf swing. All of our previous webinars are actually recorded and put on our YouTube page, so please feel free to join and subscribe there, or just go on and watch them. If you go to YouTube, search for Kinetic TV, and you'll be able to find the videos under the Kinetic logo. So again, I appreciate everybody joining us today. And again, if you have any questions, please feel free to reach out to me at Mike F at kineticptpa.com. Thanks for joining us, guys.